What's up, everybody? It's Dr. Winters, and I'm back with, guess what? Yes, another video of all the craziest videos you guys tagged me in. Today we're talking scams. We're gonna be answering the information. Is it fact? Is it cap? You know, that's kind of basically the gist of today's video. We got crazy videos from, does this whitening work? Does this toothpaste magically whiten things? Everything else in between. And we'll probably learn some stuff along the way too. So let's go ahead and get right into it.
This is coffee mixed with cigarette butt water. I'm going to show you exactly what it does to your teeth. I have 2 cups of clear water right here, and one I'm going to use the Body Axle whitening toothpaste, and the other I'm going to use another random brand. I'm going to pour the coffee water in both cups. Same amount of disgusting mix in both cups. Body Axle goes in this one. The other brand in this one.
Okay, first off, I want to just say something real quick. I want you to think about what just happened here. The toothpaste is now inside the coffee water. I just want you to note that fact for later.
Watch what happens. 3, 2, 1.
Okay, now the toothbrush is mixing it up and... oh my gosh, pause it on her face. She's so surprised. Because she's scamming you and getting away with it. But let's continue. Let's see what she says.
That's insane. This cup still brown did nothing. This cup completely clear. This toothpaste has niacinamide, which is scientifically proven to whiten your teeth. It's also antibacterial, so it actually cleans your mouth while it whitens. There are so many fake versions. I'm just gonna stop right now because this is just complete bullcrap. And it honestly pisses me off, to be honest, that this is even possible in the realm of the internet. First off, niacinamide does not whiten your teeth at all, so that's kind of stupid anyways to talk about. But let's talk about the thing in the room is how the heck did that thing turn clear, Bentist? And that was why I really thought it was important for you to notice that the toothpaste went inside both cups, and guess what? Nothing happened. That toothpaste didn't magically turn clear. It didn't even turn slightly less yellow when you put the toothpaste in. And if the toothpaste is the thing that clears out the actual stain, you think it would do that. It was only when the toothbrush got dipped down in and swirled around that it turned clear. But Bentist, it still turned clear, and that's pretty impressive. Yeah, for a parlor magic trick, because all she did was she dunked what's called pH indicator fluid liquid, an activator on that toothbrush. So if you guys don't know, there's a pH indicator liquid. You can put it in there, and it goes from that dark brown color to clear if you hit a certain pH threshold. So sometimes you can use their activator, or you can even add like an acid, like vinegar or something like that, and dip the toothbrush in vinegar. And then if you swirl around in the water, voila, and magically turns clear, and it looks amazing. Like it just got rid of the stains. But really all she did was she dipped one toothbrush probably in vinegar, the other toothbrush has nothing on it, and so when you dip them in there, one turns clear and one doesn't, basically alluding to you guys that it's going to magically clear all this stain off your teeth, when in fact it completely doesn't. That is what we call illegal in the US marketing system. You're not allowed to do false claims to try and sell a product. So you are 100% under legal scrutiny here, doing something 100% illegal. And then on top of that, she's wearing dental scrubs to make you believe that she's a dental professional, or she's a hygienist, or she has some knowledge. Also, fun fact, is illegal to do. You can't pretend to be a dentist. You can't pretend to be somebody like this. And I've seen this girl's videos 1,000 times tagged on me. This toothpaste has sold 50,000 units of toothpaste. Do you know that's more units of toothpaste than we've sold ever on our toothpaste? And it's all stuff from a crappy Chinese brand that does not work, that is just absolutely scamming you of your stuff. And I am so insane. I'm so mad that these people are allowed to do this. I'm not allowed to do that. If I put my toothpaste on there and was like, hey, this whitens all your shades in 1 second, yeah, I would sell a ton of units, but my whole entire credibility would be shot, and you guys would never trust anything I have to say, which is why I made something nice, so you guys could have products that were actually known to work, that are science-backed and no BS. Anyways, let's see if in the comments people are actually seeing through this facade or not. Some people are calling out some of the scams. Are like, oh girl, you didn't even touch the other toothpaste. The fact that she hardly mixed the other toothpaste, but the good toothpaste, it has nothing to do with the mixing, guys. It's literally just that one has the activator fluid on it and one doesn't. She can mix till the cows come home. It does not matter, because only one is gonna do the trick, because it's a pH indicator liquid. It has nothing to do with coffee or stain or anything. If you mix the other one, I will possibly consider buying it. It shows that people are so easily scammed into buying this crap online, which is why I told you we came up with our company so you didn't have to be worried about being scammed. But that's actually crazy. Low-key sold me. I mean, low-key, you got scammed. And it's sad to me. Tag this girl, bully her, tell her she can't do it, report her ads, do anything you can to stop this girl from doing this, because this is, I mean, literally, she could get sued to oblivion for doing this. This is literally against all of the rules of advertising. So I would highly recommend her to stop doing any of this. And anybody that you ever see doing a Body Excel toothpaste ad, or any of the other, it was Marvin's toothpaste before that, and all these other people doing these scam things, report them, because it is illegal to be doing this, and you guys are getting all of your hard-earned money stolen from you for some stupid reasons that doesn't even do anything.
And next up, we got a guy who's telling us that he's got the perfect whitening routine, and we're gonna take a look, see what we've got going on, and see if it's fact or cap. Is it a scam? Is it not? We will see. Let's go ahead and check it out.
Never use toothpaste. You realize this shit kills your teeth?
Okay, whoa, okay. First, whoa, big claims right out of the gate. Toothpaste kills your testosterone? Let me do a quick little Google Scholar search here.
A few minutes later.
So basically, it turns out that high levels of fluoride here can directly impact your Leydig cells, which are in the testes, that are crucial for testosterone production. That's where he's probably getting this. He's probably saying that, you know, fluoride, toothpaste, henceforth, you're going to lower your testosterone. But they mixed the hard part of the study here was that it was very high levels of fluoride, very high levels, and you're probably not going to get that significant amount of fluoride in something like that unless you have insane amounts of fluoride in well water or something like that in your area. Normally the amount that's in toothpaste is very, very mild, so it's probably not going to cause anything. I mean, if you really were worried about it, you could use our non-fluoride toothpaste, which is a 10% nanohydroxyapatite. Doesn't have fluoride in it. That, you know, remineralizes the same without the fluoride effect. But even then, I don't think the fluoride's... He's not off to a great start. I see where he's coming from, but so far not true. But let's see.
Blocks your pituitary gland, making you have lower energy and giving you brain fog. Instead of using some bullshit toothpaste in the morning, use baking soda so your teeth get whiter. Okay. And then at night, use coconut oil so you kill all the bacteria while you're sleeping.
Okay, so basically, he said that you need to do two things. You need to use baking soda only, and that's to brush your teeth. And then we use coconut oil at night to just kill bacteria. So let's go ahead and talk about those two things. So basically, the baking soda is actually a product in a lot of toothpastes, and it has a low dent and abrasion limit, which means it's not going to rip off your enamel. And so actually baking soda is in some really good toothpaste to help you do a lot of good things. So I actually don't have an issue. You would just mix some baking soda with some water. Personally, I find that it tastes really nasty, so I would rather you just use like an Arm & Hammer baking soda toothpaste. If you really wanted to use baking soda, there's tons of toothpaste out there with baking soda in them, and even non-fluoride versions. If you really were scared about the testosterone thing, you can even use, like I said, our 10% nanohydroxyapatite. Now, the second part is the coconut oil. There is a few studies that show there could be some mild beneficialness to coconut oil, but most of them actually showed that the benefit was coming from you just swishing it. In coconut oil, they want you to swish for 20 minutes with this stuff to get this stuff done. And so the studies showed that they did this, and they were like, we think that the only plaque removal we're getting is just from the physical mechanical act of swishing around coconut oil. So I haven't really seen any like good research articles and stuff to really convince me that coconut oil is actually a good thing. I think it's kind of just a scammy type thing to get you to buy coconut oil. They did a really good job marketing it though, because tons of people buy jars and jars of coconut oil and then clog up their sinks and don't really get much different from it. The really big thing is just the mechanical act of removing the plaque from your teeth, which you could just use a toothbrush and floss by itself with no toothpaste, no anything if you really wanted to, and you would actually have a very, very healthy mouth if you did that. So don't think you have to be too worried about the fluoride. Coconut oil I would pass on, and the baking soda I don't have a problem with. It's probably not going to whiten your teeth, but it will do a pretty good job cleaning. Let's see what they say in the comments. Somebody said, next thing you're going to tell me I can't drink water, and it's true. It feels like it that one. It's like everybody's just telling you everything that you can't have, and it's because of some study that showed one little tiny thing that they just like mass blanket everything else on. Someone said, what about Arm & Hammer's baking soda toothpaste? Exactly, that's what I'm saying. Just get something that actually tastes halfway decent that has the baking soda in it. And if you really don't like fluoride, like I said, you can get a fluoride-free toothpaste. Someone said, I use strawberry Spider-Man toothpaste, dog. You know, that's what I'm saying. And you'll be just fine using the strawberry Spider-Man toothpaste. Although that does have a lower level of fluoride because it's a kid's toothpaste, which maybe you like. All right, this next one is a toothbrush that you guys tagged me and said, Bentist, is this a scam or not? Let's see. All right, day 12 of brushing my teeth in 20 seconds. Oh, I see exactly what he's doing there. The 8080 HD toothbrush set, also known as the auto brush, is known as like 1,000 different versions of this copycat going. Yeah, so I mean, my opinions on this is I'm not the biggest fan for a couple reasons. Listen, I get it. You know, I'm an inventor, I engineer, I make all these products myself, and I love the idea of automatically brushing your teeth. That would be sick. And if you could even go in and like floss as well, and maybe eventually one day we're gonna get there. But personally, this is not my favorite for a couple reasons. Let's go ahead and get into it. The first is that I do like having some type of remineralization, or in fact, our new toothpaste coming out in Q4, which will change the oral care landscape forever, which I can't talk to you about yet. But you're gonna need some toothpaste on there, right? And in these big ones, you really need to add a lot of toothpaste all the way around to get on every single aspect, because you're not pasting just one toothbrush. You're pasting like 40 toothbrushes that are all intertwined together, right? So you have to use more product, which is annoying because the toothpaste can be expensive, and if you're using a ton, you run out really quickly. So that's my first kind of issue with it. Two is that they try to put the bristles on there and this in, and they angle up and they can do some stuff, and it does just kind of move like this, which you would think would work well, but if you actually use disclosing tablets and see how much it gets off, it actually leaves a decent amount of plaque on there. So it's like 10% or so is still covered in plaque, specifically between the teeth in these areas, because you just don't have, you know, the ability to kind of really work it in there really finely and good like you do with a toothbrush. And especially floss, you still need to floss with this thing as well. And the last thing I don't like is that he says that he does it in 20 seconds. And like I said, you really need 2 minutes. I understand like that's 20 seconds over all of them, and so it's probably done, but I don't want people to just like get this and be like for 10 seconds and then take it out, because they're still going to be probably missing stuff. Another big thing is gum wear that I see. You know, this is a lot of like stiffer bristles that are on your teeth, and they go up onto your gum tissue, and so you're massaging your gum at the same rate that you do your tooth, and that's not good, because you need more pressure on your teeth, less pressure on your gum tissue, and we can actually probably will see gum resorption over time in some of these people that are really like rubbing it hard and like getting it on their gum tissue. So that's something that I foresee could be an issue in the future with using these. So basically you use a lot of product, it doesn't quite get everything perfectly, and then on top of that you could see some issues with maybe some gum resorption or gum wear if the bristles are made too hard, you know, and all these different things, unfortunately. And also it costs a ton of money, way more than just a manual regular toothbrush. So let's see what the comments had to say. I like the two first photos of people are. It's like, you know, at some point you're doing too much, okay? At some point just use this regular toothbrush. Use a basic dollar toothbrush from Dollar Tree if you really want to. I like that. Somebody said, for $300, I'm gonna keep brushing for 2 minutes and flossing. How about that? Yeah, and you're gonna save a lot of money. I mean, you could get so many tubes of toothpaste for that same amount of money, and floss and toothbrushes for life at that cost. So definitely, that's very expensive. I didn't know it's $300. That's insane. Somebody said, if I did this, I would have gum recession in 3 days. And I'm glad other people are thinking about this too, because that was the first thing that I thought. I was like, oh my gosh, like that thing's so high powered, and I bet you those bristles are hard to try and get all the plaque off, and that really would rip your gum tissue a lot unless they make it specifically, you know, a very soft bristle brush. Someone said, from the makers of a car wash. That's funny, I'm not gonna lie. That's pretty good. But I don't know, what do you guys, let me know down below if you would buy this, or if you would just wait till, or you just brush your teeth with something regular, you know, maybe it's a little too extra. All right, next up we got a braces product that could change the market forever. Let's go ahead and take a look at it and see if it's really that good or if it's not.
So
we got a braces.
And your braces keep poking the insides of your gums or cutting your mouth up. Invest, baby. Treat yourself.
Okay.
On Amazon, these are some lip protectors.
Lip protectors. All right, let's see it in action.
So you just take this little
She's taking it.
plastic strip. On the inside of this, it has these little.
It looks like it's got like little clips to like clip onto the actual wire in between, I'm thinking. Let's see. How does she know the exact space of every single tooth? That's the only thing that would worry me about this, is that, like, you know, it's hard to get it perfectly exact. You know, everybody's teeth are different widths and stuff, so. But it looks like it snapped on pretty good. Now that's actually pretty awesome, I'm not gonna lie. You know, this is actually something that's been around for a while. It's called comfort covers. It looks like Amazon has some different versions you can buy now. We always knew them as comfort covers. Those ones just go on the top. They don't have like the middle clicky parts. I don't know if I like those as much, because like I said, the in-between of people's teeth are all different. Some people's are wider and shorter, so it's probably gonna get off at some point and not fit correctly at some point, but I don't have an issue with this at all. I mean, I guess you could be worried, you know, if somebody has a lot of crowding, it's not gonna work because it can't, like, you know, mold to it. So you do have to have your teeth fairly straight for this to happen. But I don't think this is bad at all. This is actually a good idea and not a scam. This is something that I actually recommend to my patients, comfort covers. I actually really like Gishy Goo and some other, you know, Ortho Dots. Those are two really good wax products as well that you can use for these. But yeah, this is actually something that I think is a pretty good braces like that, and one of our not scams of the day, which I think is great. Let's see what the people said in the comments. So I said, what exactly is this called? My son is getting braces and want to make sure he's good and comfortable. Well, we call them comfort covers. You could probably just type in braces comfort covers on Amazon and you'll find probably a ton of them. As much as braces are, this should be free when you get them. And actually, that's a really good idea. I might check into this. We do give people the braces wax when they get their braces, But I mean, the comfort covers, I mean, maybe that makes sense. To be our fair, like the wax fits on everybody, crowded teeth, not crowded teeth, everything in between. These comfort covers really only work when the teeth are fairly straight right out of the gate, which is not that many people, because most people are coming to us because they got crooked teeth, you know what I mean? Someone said, where was this 15 years ago? That's why, back in my day, when we had braces, we had to walk uphill both ways, and we had to have those crazy metal bands around all of our teeth, and we had to have headgear. We really did have it that bad back then, didn't we, man? You guys are so lucky now. But let me know down below, would you get these, or do you think they're not worth it, or do you think they're awesome? Let me know. All right, we got another whitening hack. This person says, for sure this is gonna work. Surely it's gonna work, right? There's so many that don't work, but you know, maybe this one will.
Hey guys, I'm about to whiten my teeth at home.
I'm seeing the baking soda right out of the gate.
Buy whitening shit, so baking soda, I think that's too much.
Okay, so first off, she got baking soda. The caption says, this actually worked. This was 2 hours ago, and they are for real white. DIY whitening. Okay, so she put some baking soda in there. Now, looking at the research, there's nothing that really just screams out at me that the baking soda itself is gonna whiten your teeth. It will do some light abrasion to get some of the surface stain off, but not necessarily go inside your teeth and whiten. So let's see, she's gotta add something else here for me to approve this, because right now it's just...
Right, so...
Speaking of which...
Peroxide.
Let's get some hydrogen peroxide.
Now
that
you want it to be like a...
is what I like to
paste,
see.
Like a... Yeah.
Yeah, you're gonna need more baking soda now.
Way too much. I'm gonna go get some more baking soda.
Exactly.
I ruined it.
Yeah, you want to make it more like a paste.
This will literally be like a toothpaste, or like when you get a bee sting, you needed that paste. Okay, we're back, and I'm only doing all this shit because I don't even have a car and I have nothing to do.
Is she gonna add anything else? Let's see. And the next part is mine. Is like, now that she's made it, how is she gonna put it on her?
It should be a little bit pastier than that. Let me brush my teeth first with regular toothpaste, just because it's the morning, and then I'm gonna do that whitening stuff.
Okay, so she's cleaning her teeth with the toothbrush and toothpaste first to keep it clean, which I like. It's getting the surface stain off there. It's unplugging some organic holes and stuff like that. And so now she's taking her paste and brushing it on. That's gotta taste gnarly. Let's see what she does afterwards.
No. It hurt. Okay.
It hurts.
I think it definitely did work, however, it kind of hurt. But it doesn't hurt like whitening strips does. Like, so that's why I'm trying to do it like this. I don't want to use whitening strips. I just feel like it'll hurt forever. Well, there's your at-home.
Well, there you go. So, what are my thoughts on this? Well, to be honest, I think she was close, okay? But there's some issues with the way that she's doing this. So, she's brushing this on her teeth, right? But the way that it works is the hydrogen peroxide is doing the whitening. The baking soda is just kind of a vehicle to brush it on. That's great. It's doing a little bit, but it's not going to do the whitening. The hydrogen peroxide is doing the whitening, okay? But the problem is by just brushing it on your teeth, she probably rinsed it out really quickly. You needed time on your teeth. So she said it started to hurt. Why did it start to hurt? Because she's brushing hydrogen peroxide up on her gum tissue and all these other places that hydrogen peroxide is not supposed to be, and it will cause chemical burns on there. You actually see people that have white gums from where the hydrogen peroxide has burned their gums. And so that's why we tell people, try not to swish with it if you don't have to, and then brushing on there too. And then you have to leave it on there. You know, it has to be on there for at least 15-30 minutes to really get some good whitening action going. You can't just brush your teeth for 30 seconds and then, you know, spit it out. That's not going to do much for you. That's why she was like, it started to hurt, but then I rinse it out and it doesn't hurt anymore. But whitening strips do hurt. Well, that's because of the sensitivity that you're getting. So the way that whitening works is it unplugs these holes, goes in and whitens from the inside out and comes on out. And that's actually why we invented our LumiSmart strips, to be able to give you that hydrogen peroxide whitening that sticks on the teeth so it can stay there for 30 to 60 minutes, but it doesn't taste nasty. And it only, you can see those little layers on there, those little peelable layers. That's so it can only go on the front of your teeth if you want it to. That cuts your sensitivity by up to 60%. It's the first and only whitening strip in the market to do that. I know, because we patented it. And so actually this is a fact. It does work, but I do think that the way that she implemented it could be better. I wouldn't quite do it this way because I think it's just not going to be on your teeth long enough, and you could get some chemical burns on your gums and stuff. So maybe kind of like a fact cap together. But let me know, would you try this? Hopefully not. Hopefully you just get our LumiSmart whitening strips. They're 10% hydrogen peroxide. They're going to whiten your teeth really well, and you're not going to have that crazy sensitivity or the gum pain that she was having. Okay, so this one came up with a braces life hack that she says works amazingly well. Let's see if it's really true or not. All right, does anybody else like pick up their bracket and it actually stops hurting? Please don't tell me I'm the only one. Well, that's actually an interesting one, because what she is doing might actually be able to help you in times of need, especially if you have braces. Because basically the way braces works is it's time and force on pressure on your teeth over time that move those teeth, and those wires are putting pressure. So if your teeth are up here, we want to put pressure slowly down so that teeth slowly starts growing through the bone downwards. And so if you're pushing pressure this way and it's starting to hurt, if you push your bracket in the opposite direction, you're actually going to relieve that pressure on the tooth, and then you will feel some relief because, well, the pain receptors and the pressure is not continuing on your mouth. And in fact, another life hack that you can do is the wires are made of what's called a heat activated nickel titanium. They actually start out straight. We bend them into all these crazy ways to get between your crooked teeth. Yes, that's right. I know you little crooked teeth over there. And then the heat of your mouth actually makes those wires want to go from crooked back to straight. And that's how we actually straighten your teeth. That's how we put the force on your teeth. You notice there I said they were heat activated. So you don't have to actually push on it like this because it's only going to be super temporary. A better way of doing it would be go to get some ice water out of your kitchen, put it in there and swoosh around that ice water for a little bit. And that'll actually deactivate that heat activated wire, making it passive, and give you about 10 to 15 minutes of pressure relief to help you with that. Another thing is just, take some, don't take ibuprofen, take Tylenol or something like that to help with some of that inflammation and pain response. That'll help as well. Let's see what the people said in the comments. Someone said, I got braces 4 hours ago, no pain. Is this normal? And she responds that just wait until the morning. And that's actually so true. Like people get in there like, this doesn't hurt at all, because it's actually the pain response that happens. It's more like a muscle soreness that happens from moving your teeth that happens over time. So yes, they will be really sore tomorrow morning, but that will be temporary. It's only for a week or two, and then your body gets used to that pain response, and then it stops sending those signals. Hence why your braces only hurt for the first week or two, and then they stop. Is it just me, or does warm stuff feel better on your braces than cold stuff? And sometimes that happens. The warm stuff is more like it's desensitizing the nerve, where the cold stuff is actually desensitizing the wire, causing less pressure on your mouth. And then somebody says, but when you let go, it hurts so bad. And that's what I was trying to say. Like pushing it up is only going to hurt temporarily unless you want to just hold your finger there all day long. The ice water wire situation is going to help you way more. I've had Invisalign for a year. My teeth are turning yellow, and now I have gum recession. So here's some fun things that nobody tells you about Invisalign. Let's see. Oh my gosh. Now I'm not seeing a terrible amount of gum recession there, but maybe her teeth are getting yellow, or maybe she does see something, but let's talk about it. Is this possible? Now, can both these things happen during Invisalign? Yes. Can they happen because of Invisalign? Not really. And this is actually because of the question there, during versus that. It's because it's something that you're doing that's causing that. Let's talk about it. So we do see some staining sometimes of the teeth during Invisalign because, well, you have plastic covering your teeth. So if you're drinking, tea, coffee, beverages, things like that, and you're maybe putting your tray back in right after you wear it, you're trapping in all of those stain-causing materials, the hot Cheetos, the coffee, the tea, whatever it is, you're trapping it up against your teeth for the entire day while you're wearing those trays. And some people, even crazy enough, drink the coffee and wine and stuff like that while they're wearing their Invisalign aligners and stuff. And so if you're doing that, yes, you are going to see an increase of staining. But in fact, I went through Invisalign, I didn't have any staining at all because I only drink water and I brush my teeth before I put them back on. So that would be my tip for you if you're getting staining, to every time you're taking your Invisalign out, you're eating, you're drinking, you're doing whatever, do a quick swish of your mouth with water really helps, or do a very quick little brushing, and then that will help you get rid of those staining molecules and stop your teeth from getting stained while you're in Invisalign. Now the other part is the gum recession. Now that could be two different things. One, she could have had more gum tissue overlaying her teeth, and to where she actually had more teeth and the gum actually was overgrown. And so sometimes when you put the aligners on that pressure will cause those gums to recede back a little bit, but it's a good thing because it's actually an overgrowth gum that's now revealing more of your tooth. Now, we do see sometimes that I can see recession in a few areas, particularly in the back and stuff. Now, this is not normally because of the actual aligners causing the problem, but it's because of two different things that I'm seeing. One is that they brush their teeth a lot more because the aligners are in their mouth. And so unfortunately, they think brushing harder is going to get the gunk and the stain off better. And so if they're brushing really hard, and actually, fun fact, it's normally the people with no cavities. And I was looking at her thing and she says, I brush every day, I floss, I tongue scrape, I mouthwash, I go to the dentist every 6 months, I've had 0 cavities. So this tells me that she's an overachiever in the cleaning. And normally what this means is she's brushing too hard. And if you're really brushing and trying to get everything off, guilty, I do it as well sometimes, you can actually cause gum recession by over cleaning and over putting pressure on those gums. Another thing we see is in the canine area, because people will take off their aligners with one fingernail and they'll just do it in the same spot over and over again. And then jamming their fingernail into their gum tissue there can actually cause recession in there. So if you're taking off these aligners, I always tell you, grab them from the back, pull them down with the pads of your fingers, and then pull them all straight down together. And that should be the same thing with your retainers as well, because we don't want to take it off in the same spot every time, because you can see gum recession in that area that you're taking your retainer or Invisalign off in the same area. So can these happen? Yes. Is it because of the Invisalign? No, it's probably because of some other things that are happening that she doesn't quite understand. Let's see what they say in the comments. Somebody said, any type of movement as an adult may cause some recession due to bone and a thinner gum tissue. Invisalign or traditional braces may cause the same issue actually. And so actually, I didn't even think about that. That is true. If you have underlying thin bone and you have a lot of crowding and your orthodontist or dentist is not catching that, that's more of a dentist issue than the Invisalign though. And then you can actually unravel and you can actually go through the bone and cause some unraveling. This is why we actually never want to see you with flared out teeth when you're done, because that means that your dentist or orthodontist did not do a good job understanding what you have going on. If you're too flared, we do IPR at our office where we actually polish between the teeth to bring them back up. And if you're too severe, sometimes you have to get teeth removed. Somebody also said people get gum recession from not properly cleaning their Invisalign, which is true. If you have a giant amount of plaque and calculus and gunk that's sitting on top of your teeth all the time, your bone will actually get inflamed, go up, and then the gum will follow it along, causing that recession. Someone else said, is this my warning to not get Invisalign and suck it up and just get regular braces? No, I mean, like I said, honestly, I would say talk to your dentist or orthodontist and see what's better for you. Some cases Invisalign works really well. Some cases traditional braces works really well. And some of it is just depending on you as a person and how well you can take care of things like aligners and things like that. But like I said, if you follow what I do, you're taking care of your teeth, you're not brushing exorbitantly too hard, and you're taking out your aligners very well, you're not gonna have any issue with Invisalign. And the same thing can happen with braces too. You know, if you're brushing really bad or maybe more gunk is sitting on your teeth and causing plaque buildup, there's a whole different set of reasons why you can get gum recession or problems with braces. So, I mean, they each have their pros and cons, but as long as you're taking care of your teeth and doing a good job making sure you're getting rid of all the stain causing stuff and you're not brushing too hard or causing damage to your gums, you're probably gonna be in a good spot. And there you go, just like that, we went through some fact and captain scams and everything else in between, and hopefully you learned some stuff and now you know where to stay away from it and what's real and what's not. If you're seeing videos pop up here and here, that's because the YouTube algorithm thinks you would like to watch them, and you probably would, and you'd also probably need to subscribe because I'm trying to get to 10 million followers and I can only do it with your help. So either way, I will see you next week in another video and we will continue to keep learning together. Until then, I'll see you next time. Peace.